Right, it should work now, and I should be able to see everybody in a moment signing on. So folks, welcome. I'm just going to prepare my screen itself. Here we go. And there we are. Okay, so there we go. And I can see that people are joining us. So welcome everyone. We have literally 1 minute to go before we get this started. Thank you for all of you who have put in your questions, because I essentially intend to answer everything step by step. So you can, so you don't make the mistakes that I made when I did my prescribing. So right now, can I just confirm, Hina, Vicky, Alia, whoever's there at the moment, that you can hear me, you can see me, everything is loud and clear. And that my phone telling me it's 7 o'clock, so we need to start, which is great. So we are absolutely on time. And can anyone just write on the chat that you can hear me? Chrissy, Hina, somebody just confirm that we're all good to go. Yep, thank you, Hina. And thanks, Hina, for getting in touch and informing my colleague about the various questions. Fantastic. Thank you very much for everyone who's got involved. Brilliant, Chrissy. So welcome, everyone. For those of you who don't know me, my name is Fahim. I'm a pharmacy prescriber, contractor, founder of Medline. And the plan is today to make sure that all of you can leave knowing step by step how to develop your non-medical prescribing, understand your scope of profession, understand the application, which university should I go to, online, how do I decide what I prescribe in, how do I find a DMP, how long is the course, everything that you've asked, I intend to cover it today. That's basically the plan. From start to finish, I intend to cover that for you. So first of all, I think it's very important for you to know essentially what my mission is and what is Medline trying to accomplish, or what is my personal mission. And it's literally for you folks to be the best versions of yourself. And so you can go out there and make a difference not only to your life, but to other people's life. And I'm a firm believer that life is very, very short, and we should enjoy it to the absolute maximum and really push ourselves to the limit. I think all of us here today have great potential. We're all capable of achieving way more than what we're doing at the moment, but it requires you to focus on this and focusing on the right things. So I came across a wonderful book, and it's called Seven Things That Effective People Do, something like this, that the book is termed. And it talks about how you need to be very, very careful with where you invest your time, how you use your energy, because if you can get this part right and you can focus on those things that contribute to your overall mission, overall objectives, whether that's spending time with your family or developing your professional life, you will get results. And that's why, whether it's a webinar, whether it's someone calling me for advice, I try to do the best that I can, because I know this overall contributes to my mission statement, and that is to inspire us all to be the best versions of ourselves so we can make a difference in this world. That is essentially what I want to do. So with that being said, folks, let's quickly get into this. And this is my vision. I believe that it is totally possible for us to actually create a world where we don't worry about access to healthcare. We don't worry about having unclean water. We don't worry about malaria. We don't worry about dengue. We don't worry about COVID, where people are getting access to healthcare, access to medicine, and that's delivered by people like yourself and myself, who are inspired, who want to make a difference and love what they do every single day. And just yesterday, I saw a TikTok video. My wife had sent it to me, and it was about this celebrity who basically says that I'm so fortunate to do what I love every single day. And it really kind of resonated with me that is such a beautiful statement, that you're able to do what you love every single day and get paid for it, but feel fulfilled. So this is the plan, that all of us feel like this. And that's why, for those of you who do want to progress your career, who want to become prescribers, who want to develop yourself, you're in the right place. So definitely switch your phones off and let's get into this. So that's a bit about the team. That's some of the clinicians who work with us. There's myself, Dr. Akib, Dr. James, Dr. Ben. There's plenty now. There's too many people. I can't remember half of the names as well. So first of all, why should you even bother becoming a prescriber? Who can list me 2 or 3 reasons on the chat now why some of you would want to become prescribers? So Hina, Alia, Kareem, Chrissy, TJ, whoever's here today, tell me why you want to do your prescribing. What is your kind of reason for wanting to become a prescriber? What are your reasons? Just give me, everyone, just give me a reason. I'll start off with mine. The reason that I wanted to become a prescriber was because I saw that there was a gap in the market. And I felt that as a pharmacist, why can't I plug that gap and make a difference to people's lives? That's what I did it. And absolutely best place to help the community, easy access to patients, well done. And Abdul, again, perfect, upskilling, absolutely, you're spot on, is prescribing is the next step for us. So if you can imagine kind of qualifying as a pharmacist, doing your pre-reg, you know, maybe you then go on to become a pharmacist manager. But the reality is that being able to prescribe, being able to manage and treat, it itself is an absolutely wonderful place to be. So I agree with all of you that prescribing is a tool that we can all use to benefit. And the reality is that the NHS is very clear, is that the NHS needs support. It feels that the future of the pharmacist is this. So if you don't do it, I feel that you might not have a job. So keep that in mind. I fully believe that if you don't develop yourself in the future, I can't see how you'd get along. Again, dispensing isn't the key anymore. And, you know, there's also, it's important for you to remember that there are more professionals who are essentially, I wouldn't say competing, but are also doing similar roles. So you've got our nurses, we've got physios, you've got various other professional physicians associates, nursing associates, all who are making their way through. So keep that in mind. I also find that patients are now being referred. How many of you are actually seeing patients being referred by the GP CPCS service or the CP CPCS service? CP CPCS service? I thought it was just, sorry, GP CPCS service and the CPCS service. How many of you are seeing patients? Are they starting to come through? Are you folks finding more and more consultations coming through? We're certainly finding in our pharmacy that we're finding more and more patients coming through the CPCS service. It requires us to work at a higher level. So hopefully I'm hoping that a lot of you folks are seeing that as well. Another thing is that every year there's 3,000 GPs short, and it takes around 7 years plus to become a GP. So even with all the schools of medicine, even with everything open, there is a shortage. So keep that in mind, that there is certainly an opportunity for you all to do this. So opportunity number one is to uplift yourself. So uplift, this is why. Number two, make difference to lives. Number three, potential for revenue. So you could set up your private clinic, you could work in general practice, you could work in out of hours, you could go and offer new services from a pharmacy. So there's definitely potential there. And fulfillment. I feel that with being able to prescribe, being able to diagnose, it just gives you something else. And I didn't study 5 years, 6 years to just stick a label on a box. So that's what my thoughts are. But anyway, let's move on to the crux of today's conversation. And you need to understand this. I need you to understand this, because once you understand this, it will make a lot of sense why the non-medical prescribing course is not probably what you're looking for. And right, I said that the non-medical prescribing course is probably not what you're looking for, and you need to think a bit more outside the box to be able to achieve your dreams. I'll tell you in a moment. So number one, how did non-medical prescribing happen? Well, in 1986, we had this Cumberledge report. And this report basically established that nurses were diagnosing, but the GP or the doctor was prescribing. So you tell me, what is the problem with this person doing the diagnosis? So this person is diagnosing, but the prescription is being written by this person. He writes the RX. So he writes RX. Who can tell me what the problem with this arrangement is? Where the diagnosis happens here, you get a phone call, and then this person basically says, right, that's fine, I'll issue a prescription, and this then goes to the patient. What is the problem with this? Why can't we all operate like this? What's wrong if I or one of you folks decided to become a prescriber for everybody? What is wrong with this concept? Why did they introduce non-medical prescribing? Who can tell me this now by understanding this concept? Anybody here today can tell me why this is a problem? Don't be shy, folks. So we've got Vicky, Tasoon, Kareem, Aliyah. Who can tell me? Tell me why this is a problem. What is the problem with this arrangement of a nurse diagnosing and the doctor prescribing? Who can tell me? Thank you very much for applying. And yeah, I guess you're kind of on the right tracks, but yes, you're absolutely right, I guess, that essentially the diagnosis and the prescription should be done essentially by, well, I guess the problem is if I'm diagnosing and you're prescribing, who's responsible for the care? Let me repeat that. I'm diagnosing and I call you up. Yes, and I call you up and I say, hey, could you write a prescription for phenoxymethylpenicillin? And you write the script. Who's responsible? The reality is that the responsibility could fall on both. It could be both. It could be the diagnosis person or the prescriber. So what they realized was that nurses, and this is the point, nurses had the experience, nurses had seen the patients, nurses could take a history, nurses could do a physical examination, nurses understood a bit about the clinical diagnosis, so they thought, right, why don't we let them prescribe? This is the key that you have to remember, that when this course was developed, this was developed on this underpinning knowledge that you can diagnose and treat. You have an understanding of anatomy and physiology. You just need a qualification. And this is the reality. I'll be very frank with you and I will show you what the university process is, what they want you to do. This is on this assumption. When you're doing your non-medical prescribing, it is on the assumption, number one, you have the clinical skills. Number two, you have access to patients. Number three, you're already diagnosing and treating and you need the legal qualification. I need you all to keep that in mind. This is extremely important. Write it down, stick it on somewhere. If you're doing your non-medical prescribing and you don't understand anatomy, physiology, you don't have access to patients, you're not seeing patients, you wouldn't know what to do, then be very, very careful when you do your non-medical prescribing because it does not teach you clinical skills. There are no clinical skills, no clinical skills. It's a big fat no. So any of you who are sat here today are going to be disappointed. Do not make the mistake that I made, and that is to think, I'm going to do my prescribing, I'm going to find my doctor, and it's going to be straightforward. Nope. And I will demonstrate that to you today in a moment. So is this all clear? First of all, I just want you to trust me on this before I demonstrate to this. Does everybody make sense on what assumptions have been made before the course was actually developed? Are we all clear? Anybody got any questions about this? Is this clear? Anam, Hina, Kareem, Chrissy, Vicky, everyone clear, right? That this is on this assumption. Good, perfect. So this is great. Now, you don't have to trust me, but just bear with me. Bear with me for a second. I'll demonstrate to you what will happen. So, first of all, how do you find a university? That's the first thing. This question I get asked all the time. Fahim, how do I find a university? Where should I go? So let me show you. Let's demonstrate this practically. So first of all, let's change our screen. Here we go. And I'm hoping that you can see my desktop. And let's get out of Zoom. And let's go here. Can I confirm you folks can see my desktop? Are we all good? Okay, great. You can all see my desktop. The first thing you're going to do is to find a university. You're going to go onto Google. You're going to type in non-medical prescribing, and you're going to go and click on here. Once you've done this, you're going to click on this here. You're going to click on this tab that says, clicking on the accredited courses that help you to become a prescriber. You'll click on this. Once you've clicked on this, all these universities come up. All these universities come up. A question that I get asked all the time is, which university should I go to? The reality is, honestly, some universities are, okay, let's not badmouth anyone. Some universities have a different approach. Some universities have a totally different approach. I've also found that some universities seem to be a bit more robust and other universities are not that robust. Having taught hundreds of students to become prescribers and helped them with this, I found that not every university is actually on par with some other universities. So I'm not able to sit here and start to go through which university you should go through, which university you shouldn't go through. But if you should certainly do your research. You should ask them what the courses they provide, what learning they offer, but not all universities are the same, that's for sure. Another thing is price. Some universities will charge you £2,000 to some will do 1,500 to up to £3,000. So price is another thing, and it varies from university to university. I think a lot of it's done on their name. To be honest, none of the universities I've seen who I would say, well, this is, this university I'd recommend. It all comes down to your personal preference. Think about distance, think about price, think about where you've already had experience. Also, do not go on the name. Do not think, I want to go to Oxford University because it's got a great name, so I'm going to go there. Doesn't make a difference one bit where you go, because this is literally just a qualification. That's it. It's not focusing on competency. It doesn't really address your learning needs as such. This is all about you developing your clinicals. This is all about you being able to prescribe within your area. The universities have made it clear that this course is not designed to teach you clinical skills. So which university should I go to? Find out which one you've been to before and make a decision. Make a decision on price. Also, some universities offer face-to-face teaching. Some of them are still doing it by Zoom. Keep in mind that you will still have to attend around anything between 6 to 12 days face-to-face. So again, another question I get asked is, how many days will I need to attend? Anything between 6 to 12 days, you'll have to go face-to-face. That are mandatory, okay? Also, the course length itself, some do a very fast-track course, which I believe is 4 months, but the 6-month course is honestly the one that I'd recommend, because 4 months is just too crammed up, 6 months is adequate. That's how long it'll take you. It ends up taking around 8 months to become a prescriber from start to finish. In terms of when you can join university, normally do an intake around summertime, so May time onwards. Deadlines is normally July, August, and they take a second cohort normally in the winter time, so August, September, and sometimes some universities do a cohort in January. So you now know that January, May, June, July time, and winter, that is their intakes. You've also now learned that the course length itself is around 6 months, but it takes up to 8 months. You also now know how to find the university to go to. And in terms of going to university, it doesn't really matter which one you choose. Honestly, they're pretty similar, but some are a bit robust than others. And a lot of it is self-learning. Trust me, a lot of it's self-learning on your own, watching videos and all sorts, and I'll go through that in a minute. So, right, with that being said, the next thing I want to go through is, actually, let's not do this. We're just losing this. Is the next thing I want to go through is back here. And let's remove this. Oh God, here we go. Did I just, that was not supposed to happen, by the way. Right, can you see my way back to the normal screen? You all with me, someone? Tell me we're back to the normal screen. Great, I love it when you guys respond so fast. Beautiful, thanks Tracy for doing some admin work for me, great. So thank you very much. Okay, right. Okay, filling out the application. This is another question I get asked. Fahim, can you help me? How do I fill out the application? Please help me with the application. I need help. It's cool. That's why I'm here for you guys. Nothing to worry about. Let's go through the application. Right, let's open up an application. Here's a blank application. Okay. Okay, so this is a blank application. You need to select the right course. Make sure you select the right course. And the reality is that you want to develop your independent prescribing. Please, please, please make sure that you don't do supplementary prescribing. It is different. If you become a supplementary prescriber, you cannot write a prescription. You're working on a clinical management plan. Keep that in mind. This is a supplementary prescribing. A supplementary prescriber is someone who has like a GP or a doctor who writes the clinical management plan, and within that scope, you prescribe. You cannot prescribe outside your clinical management plan. I'm guessing a lot of you folks want to become independent prescribers. And that means that you want to be able to prescribe, diagnose autonomously without having a doctor there to basically say yes or no. I want to remind you that non-medical prescribing and independent prescribing are similar terms. Don't get confused. So what do I mean by this? So you have an independent prescriber. An independent prescriber can be a pharmacist. So it can be a pharmacist, nurse, doctor, or dentist. It means you're prescribing autonomously. However, a non-medical prescriber means you're a prescriber and you're not a medic. That is like a pharmacist, nurse, physio, anybody who is not a doctor and is prescribing. That is a non-medical prescriber. So all of you folks are going to become non-medical prescribers, and you're prescribing independently, so you're independent prescribers. So please, please, please do not get confused with the terms. Non-medical prescriber, independent prescriber means the same thing. So that being cleared, so you don't get bored and don't forget what these terms mean, let's move on. So you're going to tick this. The next, it needs some detail, who you are. I'm a pharmacist, who you registered with. Then you fill out your registration number. Then they want your date and they want your renewal. So nothing hard there. Then some personal details. So that's pretty straightforward. Personal details, that's pretty straightforward. And after that, it will ask you about funding. Who's funding your course? So either you're getting funded to do it, or you will be self-funding. And each university will have a criteria, so you need to ask yourself which area that you're going to fund on. Okay? So that most of you will be self-funded unless your pharmacy is paying for you or your GP practice, whatever. To be able to become a prescriber, to be able to do it, you have to be qualified for usually 2 years post-graduation. You've got to meet one of these and you've got to be on the register. That's the first thing. So qualified for 2 years plus, so greater than 2 years or 2 years. Number one, that's the first criteria. Number two, you've got to be on the register. And then you must have access to a prescriber. This could be a GP. This could be a pharmacist. This could be a nurse or whoever it might be. But this person has to be qualified for, I think, 2 years plus in their prescribing. Now, some people ask me, should I find a doctor or should I go with a pharmacist? My thoughts on it are that it very much depends on the level of experience that you want to be taught by. Do you want to be taught by someone whose day in, day out job is to diagnose, manage, and treat disease? Or do you want to be taught by someone who's done prescribing and works with a defined skill set? That's the question you need to answer. And my thoughts on it are that I would want to develop my skill set with someone who has a wide range of experience, has already been involved in teaching with pharmacists or nurses, and has got the knowledge and background to help and diagnose, manage, and treat disease. I got asked by a colleague of mine or a student of mine who said, Fahim, look, I found a prescriber, it's a pharmacist, what are your thoughts? I don't have an issue with the pharmacist doing a DMP, I don't have an issue with the nurse, no problem. My point is just, do they have the skill set? Have they taught? And in which area are they going to help you with? If you just specialize in one area, it does not mean that you have an understanding of everything around you. Remember, the human body is very, very complex. You could have a patient who presents with a cough. How do you know that cough is just asthma? How do you know it's not, for example, left ventricular heart failure, pulmonary embolism, or some sort of other disease? How does that clinician know? If you're a doctor, it kind of makes sense to me because you've done all the learning, but I'm not entirely convinced, I guess, that a pharmacist or a nurse can be able to have the same experience a doctor has without going through the process. I'm not saying that you have to become a doctor. I'm saying without the experience, the knowledge, the training, the exposure, have you seen that person who's gone into shock? Have you dealt with this? Have you dealt with this? You see, that's my thoughts on it. So my thoughts on it are that if you are going to be looking for someone, make sure that they've taught pharmacists before. Make sure that they're willing to support you. Make sure that they have experience. The rest is in your hands to decide. I hope that answers the question about how I choose. I would suggest to focus on your learning outcomes. What do you want to achieve in the course? Do not focus on, I just want to complete the course. Please don't make that mistake. That is too narrow thinking. You want to qualify, you want to be a great prescriber. So keep that in mind. So that's important. And before you apply to the university, you need to have a doctor. And it's becoming a lot more difficult now to find a doctor because of the shortage and COVID. It used to be easier. And a lot of you have asked me, how do I find a DMP? It is, number one, a numbers game. That you will start to approach every single surgeon, ask them, would you be happy to be my prescriber, and give them something in return. I'm happy to work for you weekends. I'm happy to train your staff. I'm happy to develop your prescribing pathways. I need you to act as a prescriber for me. You've got to develop a relationship with your local surgeries, and it is a case of knocking on that door. Keep knocking on that door. Somebody will eventually say yes, but I will tell you it's becoming a lot more tougher ever since COVID. It's becoming a lot more tougher. That is for sure. Finding a clinician right now is tricky because of the demands, and that's why it's a lot more tougher. Previously, this concept of just keep knocking on the door, you'd get results, has got a bit more trickier because of the shortage of doctors. And it's just also because there's such a drive towards pharmacists going to general practice, such that a lot of general practices have their pharmacists now. So there isn't that kind of need for us to train you up and you work for us. Does that make sense to you all? So some of you have probably tried to speak with doctors, you're locuming, you don't have that relationship, and you've struggled. And you're not the only one. It is a bit tricky at the moment. And I'll explain to you how we can help. But in order to find a DMP, you have to give them something in return. Maybe offer to work with them, maybe offer to train up their staff, explain to them that you'll do their discharge letters if you've got that training, explain to them that you'll help them develop a repeat authorization. You've got to give them something in place. And for those of you not too sure, I can certainly send you over, when I get in contact with you, the email that I drafted out to them, and you can have a look at that. You can have a look at the email that I use to get in touch with surgeries, and that should start to get you on the right tracks. So that's important. Secondly, you must make sure that you have an enhanced CRB. Enhanced CRB. Very, very important to have an enhanced CRB. Otherwise, it starts to become difficult. Again, here you go, enhanced CRB within the last 3 years. That's important. Yep, Esther, no problem. When I get in touch, I will send you the email that I drafted out. So then you need someone to support you. For those of you who are locuming or you're not locuming, you need someone to support you. There has to be a need to develop your clinical skills. Otherwise, universities are making it a lot more tricky to come onto the courses. What they're now saying is, why should we allow you to become prescribers if there's no need? What are you going to be prescribing in? Where's the need? Previously, if you were a pharmacist, you could easily do your non-medical prescribing course. You'd pay the fees and that's it. Now, the university is saying, right, what's the clinical area that you want to prescribe in and what's the need? Now, some of you asked me about scope of practice, and I want to give you the opportunity to ask me a direct question about the scope of practice. A lot of you have asked me about this scope of practice. You seem to be getting confused. What is confusing you about the scope of practice? What is confusing you about the scope of practice? What is it that you lot are getting confused with regards to the scope of practice? And anybody who wants to talk can ask me directly, what is bothering you about the scope of practice? I get this question all the time. What's my scope of practice? What should I be prescribing? What is bothering you? Who's got that question? Who wants to ask me that question? Who's got that question about scope of practice? Are you guys all cool with scope of practice or you don't understand? Abdul, Alia, Esther, Hina, Kareem, Chrissy, Serene, Vicky. If I'm guessing you're all cool with the scope of practice, that's what you're asking me, or you're very, very shy and you're knowledgeable. But essentially, I guess the universities now want you to have a very clear and defined scope of practice. They want you, remember I told you that a lot of, when this course was developed, it was developed for those nurses who and clinicians who were prescribing within their clinical set. They were prescribing within their area. And universities are now starting to pick on this, that if you are going to develop your clinical skills, then you need to be prescribing within your area that you're already diagnosing and treating disease. And you might say, Fahim, what are you talking about? Let me highlight this point for you now then. Remember I told you to keep that point there? Check this out. Let me show you something. Right. So this is by a particular university, and look what it says. Look what it says, everyone. To get into this universities, you have appropriate background knowledge of anatomy, physiology. Can you believe that they are not teaching you this? They're not teaching you anatomy, physiology anymore. You need to be able to justify that you do. You have at least 1 year's experience post-qualification. You independently, look at this, you are already independently assessing, diagnosing in your current role. You should have completed apparently you should have completed this under circumstances we will consider. So apparently now they're asking you to do this course. I won't worry about that too much, but this is the point. How many of you actually understand the importance of this? If you don't have this part going on, this course is not designed to teach you clinical skills. They made it very clear to you. Actually, you need to understand your anatomy and physiology, number one. You need to understand how to diagnose, manage, and treat disease. We are giving you a qualification, and that is it. So your scope of practice, when you ask about my scope of practice, your scope, let's make this bigger. Your scope of practice should be, so this should be in an area you are comfortable with. You are comfortable with. For example, if you're doing a dermatology course, let's say you're doing a dermatology like Esther's saying, that's fine. And with this dermatology course, the point is, have you access to patients? That's what you should ask yourself. Do you have access to patients? Are you diagnosing and managing disease already? And are you assessing patients? This is the question. A lot of pharmacists get stuck on this and they'll pick stuff like, why don't I do mine on asthma? Why don't I do mine on hypertension? It's easy. That's fine, it's easy, but are you seeing those patients? How are you going to practice? How are you going to develop your skills when you spend time with the doctor, with your patients? How do you intend to do this? If you're not seeing patients, if you're not diagnosing patients, how are you going to do it? So if Esther's doing a dermatology course, then I'm assuming at some point that she's going to have access to her patients in her pharmacy, and she intends to utilize that skill set. If you're just doing your prescribing course and want to get the qualification and just do it in any course, universities won't let you now. They'll want to know why and where are you going to use this skill? Is it going to be in your, so for a community pharmacy, I would say if you're a community pharmacy or locum, you might want to focus on minor illnesses. So if you're in a community pharmacy, you might want to focus on minor illnesses, and not all minor illnesses. One area start off with. Maybe you'll start off with UTIs. And you might say that I will develop my skills in being able to diagnose, manage, and treat uncomplicated UTIs. That's what I'll start. Or you might say, right, I've got funding from the CCG and I'm going to set up, and we're doing a warfarin clinic, stroke prevention. So I'm already assessing patients. I'm already treating patients. I'll do it in warfarin. Okay. Maybe some of you might say, actually, we've set up a hypertension clinic. We're seeing hypertensive patients. So what I'll do is I will develop my skill set in hypertension. Maybe you might say this, and then the hypertension needs to be defined. Maybe you'll say I'll do stages 1, 2, 3 with no comorbidities. I'll do stages 1, 2, 3 with no comorbidities. That's what I'll do. So you've got to have a defined scope of practice and access to patients. My own thoughts are minor illnesses, in line with the GP CPCS service. You're going to see ears, you're going to see throats, you're going to see all that. Focus on your minor illnesses because you're going to access to this. For those of you who want to do chronic conditions, ask yourself, how are you going to, like with hypertension? Tell me someone here, what things do you need to do to be able to, before you start to prescribe in hypertension? Anyone? Tell me. Other than diagnosing with the blood pressure, what else do you need to be able to take before you start them on treatment? Someone tell me. If you're going to start to do hypertension, okay, forget the history side. That's pretty straightforward because the history will guide you, but you're going to diagnose it based on their blood pressure. What needs to happen next? Okay, you need to know NICE guideline. That's true. What about the NICE guidelines? You need to know, so whenever you're diagnosing and treating hypertension, you have to check for a secondary cause. You have to do blood tests to check their U's and E's. You have to check their kidney function. You have to do all that. You should also even consider doing an ECG. You have to do a fundoscopy as well. The point is that if you're going to do hypertension and you're not doing all this, then why are you getting your skills in hypertension? What's the point? You're not going to do this in your practice. So why are you developing your skills in hypertension and making life difficult for you for your university course? Remember, once you've qualified, you can develop your skill set in anything you want. Let me repeat that again. Once you become an independent prescriber, you are not going to be annotated like this. It's not going to be Mr. Fahim Ahmed, IP, hypertension. No, it's going to be Mr. Fahim Ahmed, independent prescriber. You need to be able to prescribe autonomously, develop your skill set in any area that you're comfortable. You can treat, manage, and diagnose. So why make things difficult for you for the course? Are you all with me? Ask yourself, when I choose my scope of practice, be honest with yourself. Am I going to have access to patients? Am I going to use it? Number one. And is it beneficial for me and my organization? Am I clear on developing your scope of practice? The university wanted to be narrow, so you can't choose, I want to do minor illnesses. It has to be a minor illness, and in that, you've got to narrow it down. So if it's going to be, for example, earache, it should be acute otitis media, acute otitis externa in adults with no comorbidities systemically well. Acute otitis media in children, blah, blah, blah. You have to keep a defined scope of practice. If you're going to treat something like acne, for example, you might want to do acne with no scarring and so on. Does that make sense to you all? Are we all clear on the scope of practice? I've spent a bit of time on this because I get this question all the time. The next thing is what to expect at university. What will they teach me? Well, let's have a look at some timetables from university. Why don't we do that? Let's have a look at a timetable from university. Right, here's a timetable, folks, and have a look. Okay, as I said to you about clinical skills, check this out. Right, you have pharmacokinetics, pharmacodynamics. Great. So more pharmacy stuff, something that you studied at university for 5 years. More pharmacodynamics, adverse drug reactions. You've got a numeracy exam. You've got complex cases, apparently. Prescribing for special groups. Again, no diagnosing and treating of disease is being taught in these classes. Again, pharmacology, respiratory pharmacology, cardiovascular pharmacology, respiratory session, endocrinology. Again, no clinical skills. No clinical skills here, folks. You're going to get taught about legal aspects, legal considerations, pain pharmacology, pain, antifungals, antivirals, good old antibiotics, and you have a mock exam. And again, central nervous system, pharmacology, prescription writing, clinical management plans, legal considerations, prescription writing, mock OSCE, and competency or complementary therapies. Again, there's nothing about teaching you anatomy, physiology. There's nothing about how to diagnose, manage, and treat disease. This is not a minor illness course. They're not teaching you this. That's one university, and they're all the same pretty much. They all have very similar. Let's look at a different one. And check this out. Here's another short timetable. And again, what do we see? We see consultation models. We see introduction to pharmacology. We see pharmacology. We see clinical governance and self-study. We see more pharmacology, reflective writing, remote prescribing, numeracy exam. Oh, more maths. Portfolio, we see numeracy exams, and we see more pharmacology. Can you all see that these courses are not teaching you anywhere clinical skills? The universities have made it very clear. Your clinical skills, develop them yourself or come on other courses. Straightforward. So, wow, we've covered a lot. So we've gone through finding a university. We've gone through filling out the application. Your personal statement. Another thing I get asked all the time about my personal statement. You've got to think about your personal statement. You are advertising yourself. You are selling yourself, not literally, but you're telling them what you've done. You should be up to date with CPD. You should be up to date with your logs. You should be reflecting. They want to see this in what have you been doing all this time? Have you kept up to date? They also want to know, for example, they also want to know about your references, a professional reference. So you might need to go back to university to get your professional reference. They also want to know a reference, or that's an academic reference. They also want a professional reference. Again, universities want this. Then what happens is, I want to open up my portfolio because somebody asked me about filling out the portfolio. So I think it was one of your colleagues. So I will touch on this. I don't feel I've got the entire time to go through this, all of it, but I'll open this because I guess I'm in a good mood, so I can do this. Okay, so this is what you have to do at university. So here you go. At university, what you're going to have to fill in, you're going to have to fill out a learning contract. So you're going to have to fill out a learning contract to identify your learning needs. You have to fill that out. You also have to do some reflections, some midway reflections, and you have to fill out how much time, again, universities vary, how much time are you spending with your clinician and what have you done in those times. So you can see I've put observing a range of conditions, observing a range of conditions, observing a range of conditions. So you have this log to do. In addition to this, you're going to have to sit some OSCE exams where they're going to take a history with you. They're going to ask you to do examination. They're going to go through all this with you. They expect you to do this. You also then have to reflect. There's a reflection. And I want to show you something that somebody asked me, your competency framework. So this is the RPS competency framework. This is the Royal Pharmaceutical Society, who are essentially saying that all prescribers should be competent in these areas. You should be able to take an appropriate history. You should be able to undertake an assessment. You should be able to have access and interpret all available information. You need to demonstrate this. So this is how I demonstrate. I said, look, in terms of taking history, I've developed my own history taking model, referred to my model, and I then got my doctor to sign this, that look at my model that I've done. In terms of appropriate clinical assessment, I said, doctor, refer to my OSCE, and in front of you, you've seen me taking histories. We've done case-based discussions. I know how to take a history, and the doctor would sign this. Access and interprets all available information. Again, I wrote down that when you take a consultation, for example, hypertension, you need to review medical records, you need to access to bloods, use NEs, you must do your relevant examination, and the doctor signed this. So basically, you have to work through all of these and demonstrate these to the doctor, and then they will sign this. So some universities are slightly different, but essentially you have to demonstrate this, that you request and interpret relevant investigations. You make, confirm, and understand the final diagnosis. You understand the conditions being treated. You understand the importance of adherence and effectiveness. So this is everything you have to go through. I think this was one of the questions from the students. Does anybody have any questions regarding filling this in? I can't go through all of it, but essentially you have to map yourself for case. For example, considers potential misuse of medicines. So I said, as a pharmacist, I'm aware of potential misuse of medicines like codeine, tramadol. I'm aware of patients taking gabapentin and painkillers and monitoring this, reviewing their painkillers. And so the DPMP said, right, perfect, that's fine. And so he signed it off. Does anybody have any questions? So for university, you're going to have exams, which are written exams, multiple choice on pharmacology and numeracy. You're going to have OSCEs that you have to do. So they will give you stations. You'll have to take the history and you have to demonstrate them. Okay. In addition to this, you will also have to, do a reflective case, write your cases up and your portfolio. So there's quite a bit that you need to do. There's quite a bit that you need to do to get through this course. So you must think, right, there is my OBS with DMP. There's a numeracy exam, pharmacology exam. There are OSCEs I need to do. There are also, in addition to OSCEs, there's also paperwork to fill out, reflections, and good old essay writing. Essay writing, folks, is back. Good old essay writing is back. So you have to write your essays as well, believe it or not. This is essentially what's going to be happening through your course, and it all happens in 6 months. It is fast. It is fast. So keep that in mind. Right. So someone's asked if I do mine cases in endocrinology. Endocrinology is too broad. Endocrinology is way too broad. Endocrinology, you're talking about diabetes, thyroid, it's way too broad. Pick one area that you are going to have access to patients in, that you are going to be able to reflect on and focus on that. It needs to be more targeted. So diabetes is huge. If you're going to do diabetes, it's fine. Make sure that you keep a set area, because if someone's diabetic, you need to be able to make sure that you can assess the entire human body itself. It is huge, but it's fine. You can develop your competencies in diabetes, no problem. But keep in mind that diabetes is huge. Diabetes is big. I've got 2-3 students who are doing diabetes, and I'm spending time with them to teach them about diabetes, how to diagnose, manage, and treat it, because they've put themselves into diabetes, but it wasn't a smart thing to do. It's too huge. It's broad. You can do it, but it's huge. With all the treatment modalities out there, diabetes is huge. So keep that in mind. So I'm working with those students now to help them on their understanding of diabetes and so on. So keep that in mind. And not endocrinology, you need to be more specific. There are endocrinologists who just specialize in endocrinology. You're not going to do that in 6 months. So be more specific. I want to do diabetes. I want to do narrow form of diabetes. Maybe I just want to do type 1 or type 2 diabetes that are non-insulin dependent, whatever it might be. And, within this range. Okay, keep that in mind. So that being said, you then need to essentially, this is the university kind of thing that you need to do. So you can see that there's going to be quite a lot that you've got to go through in order to get through university, bits and bobs. Nothing is difficult, folks. None of this is hard. So please don't go away from here thinking, oh my God, it's so difficult. Nothing's hard. It's all in the mind. If you think it's hard, it's hard. It's straightforward. Nothing hard here. But this is essentially what happens, that you can do resubmissions. You need to go through this one by one for the universities, pretty much everything that I went through, okay? So what are the benefits of doing your prescribing? As I explained to you, you're going to have, you can make a difference to people's lives. You can upskill yourself. You can challenge yourself. You can get better pay packet. There's so much you can do with prescribing. So just like I have set up my private clinic, help pharmacists, there's so much you can do with it, but you've got to do it properly. You've got to do it properly, folks. You've got to do it properly. The mistakes that you're going to make, let me tell you the mistakes you're going to make, and I see all the time. Number one, some of you will go away from here thinking he's talking rubbish. Straight up. It's fine. No problem. Number two, some of you will think, right, I know it all. This is easy. And you're going to pick a topic that you're going to struggle with. Number three, some of you are going to be only interested in getting the qualification. You're not interested in developing your skills. You just want the qualification. I don't know why, but that's all you want. Number five is some of you will lack the confidence. Even though you can do this, you'll lack the confidence. That's another thing you've got to remember. So keep this in mind, that don't make the mistakes that I made. It's great you're here. Ask me questions, get in touch, have a conversation, get advice. Do not make the mistakes that I made. Ask people. You don't have to do everything yourself. You don't have to know everything, but you need to know how to get the right information. Okay, so don't make those mistakes. Don't make those mistakes. Also, some of you will just, you'll do it just for the sake of it without having a thought process in place. So just remember that. And also some of you won't have the clinical skills, and you'll land yourself in prescribing, and then you're going to come back and say, Fahim, teach me clinical skills. That's the biggest mistake you're going to make, is you're going to think, hey, my prescribing will teach me everything. No, prescribing course doesn't teach you anything. It's not there to teach you clinical skills. This is what happens when things go wrong, unfortunately. So you can see that GPHC suspends things, killer trial. Some people have died. This wasn't too long ago, 2019. This was in December 2020. So it's not too long ago, folks. It's not too long ago. Keep that in mind, that things do happen when you go wrong. My own personal thoughts are, this is how you should do it. You should know your anatomy, physiology first. You should then understand about diseases, and this is what you should know about every single disease. Write this down. For every single disease, you need to know the incidence. How common is the disease? Tell me why it's important to know about the incidence. Tell me why you should know how common a disease is. Anybody who's awake, tell me why you should know how common a disease is. Why do you care about how common a disease is? It's not a trick question. Anybody who's awake. I hope you're all awake. You wouldn't just be listening to me for an hour and sleep. Z, Esther, Serene, Esther, Chrissy, why do you care about how common a disease is? How does that help you? How does that help you? If it looks like you are all sleeping then. Well, the incidence of a disease will tell you how common a disease is. And by knowing how common a disease is, you know that if a patient has, for example, I don't know, a earache, or let's say has a sore throat or shortness of breath, you will know, right, a pulmonary embolism or asthma or left ventricular heart failure, this stuff is quite common. It's 1 in 10 people can get it. This is going to be likely some of the causes. There's no point rushing toward diseases that are not common. You should know the etiology of what the cause of the disease is. You should know that. If you know the cause, you can treat it. You should know how sex affects it. Very important. For example, ear infections, middle ear infections, more common in children than in adults. Keep that in mind because of the eustachian tube. You should know about the geography. Very, very important. Again, if somebody comes from Africa or India right now, maybe India, they could have possibly COVID. So geography is important. You should know about how age can affect the disease. Again, very important. Pathology, and that is essentially what the disease does to the body itself. So today I was teaching class on asthma, and it was a wonderful session. I was teaching them all about how, it's amazing how you get a type 1 hypersensitivity reaction. You end up getting the antigen presenting cell that goes and activates Th2 cells, that goes and activates and releases CD3, which causes release of interleukin-2 receptors. It is crazy. It is crazy on a scientific level what happens. But the crux of the story is with asthma, you're going to get increased glandular secretions, narrowing of the airway. It's going to be difficult to get air in and out. So ventilation will be affected, and you're going to have wheezing, and there's going to be a cough. That's essentially what's going to happen. And then we can diagnose that using spirometry. So again, not difficult if you're taught it properly. Again, for those of you who should understand pathology on a microscopic and a macroscopic level, you should know your signs and symptoms, and then you should know the prognosis. This is what you should know about every single disease. For those of you studying diabetes, this is how you have to know that disease, like this, from start to finish, properly. Not no Mickey Mouse stuff, it doesn't work. You're dealing with patients, folks, do it properly. Then there's history taking and consultation skills, your physical examination, clinical practice, and then we get to non-medical prescribing. The mistake that I made when I did it is I ignored everything. I said, forget this, forget all of this, forget all of this. And I just ran towards here. That's what I did. And then I ended up spending 4 or 5 years educating myself because I realized that actually the non-medical prescribing course didn't teach me any of this. It's a 6-month course. What was I expecting from a 6-month course? But I made a mistake, so don't make the mistakes that I made. Okay, so now these are again some of the benefits that we can do. Again, folks, you can better people's lives. You can make a difference. You should do your non-medical prescribing, but do it the right way. Okay, it's important. Now, a lot of you will be sat there saying, right, Fahim, how can you help us? There are 3 things that we do at Medline. Number 1 is help develop clinical skills. So we teach pharmacists, nurses, and doctors how to diagnose, manage, and treat various diseases. That's what we do. That's what we specialize in. If you want to develop your clinical skills, absolutely we can help you. Number 2, we help pharmacists to get into university and organize clinical practice and DMP. We organize that for you. That's another thing that we do. For those of you who are struggling to find a DMP and say, Fahim, honestly, I've tried everything. It doesn't work. I just need you to sort it out for me. we can do it for you. In addition to that, we help set up private clinics. So for those of you who want to set up their private clinics, we can help you do. That's essentially what we do. 3 things, pretty basic and straightforward. No left, right, and center. There's 3 things that we do. That's what we do. Fahim, you can help me develop my clinical skills? Yes. You can help me diagnose, manage, and treat disease? Yes. You can help me do a physical exam? Yes. You can help me through my course? Yes. Great. You can also help me get into university? Yes. You can organize my DMP? Yes. You can help me with the application? Yes. You can help me set up a private clinic? Yes, I can. You can help me how to design a website, search engine optimization, Google Ads, how to develop a business plan? Yes. This is what I've been doing for 10, 15 years. I've been bankrupt nearly twice. Absolutely. I can share you the mistakes that I've made. Don't make, yet I'm still here with the will of God doing extremely well. I can share my experience with you and my team from start to finish. That's what we do. So you're telling me that you can help me get into GP practice? Yes. I'm working in general practice. You can help me diagnose and treat disease? Yeah. It's not rocket science. It can all be taught if you're willing to learn. Okay. So that is essentially what we do. Moving forward, we cover hundreds of conditions. That's just some. From anatomy, so, from your ear anatomy to otitis media, otitis externa, to throat anatomy, throat physiology, nose anatomy, physiology, renal physiology, UTIs, skin conditions, eczema, psoriasis, urticaria, atopic dermatitis, rosacea, cellulitis, impetigo. This is all getting, it's building up more and more. This is not the start. We do over thousands of courses that we teach from start to finish. I've just finished off my teaching on asthma. So we have a dedicated set of skills for asthma. So your respiratory anatomy, physiology, yes. Pneumonia, yes. Bronchitis, yes. Asthma, yes. Pulmonary embolism, yes. Working on COPD, yes. Cardiovascular hypertension, we're covering it. The plan is that within 3-4 years time, the resources that we're going to have available is going to be crazy. It's going to turn out to like a university, but the content is mind-blowing. And I can guarantee you that. And with all our courses, we offer a money-back guarantee. Simple as that, with that confident. If you're on our courses and you don't like them, you've had 1,000 students, you don't like them, it's not happened with one, you have your money back. It's not going to happen now. So keep that in mind. I just want to share with you how things work at Medline. But remember, for us, it's important for you to develop your clinical skills, be the best versions of yourself, and make a difference in the world. I don't just want you to be any clinician. I want you to be the best. So in terms of our content itself, we do face-to-face classes, access to our doctors, and e-learning courses as well to assist you. And you can see our content. It's all vetted by doctors. And you can see, for example, anyone who's been on our courses, I'll put the volume a bit low. Hi, what are the learning? So you can see that we've made all our content interactive, because I'm a firm believer that education and entertainment, same thing. If I've got my student on my courses, I want you to stay hooked on my courses. I want you to fall in love with learning. That's my vision. I want you to learn. So I know that in order for me to do that, the courses need to be of that standard. So you can see, I just want to share something with you. Where is the location of the ear? Where is it located? Now you might say, for him, the ear itself is located at the side of the head, which is true. But exactly where is it located? So we've gone in and developed with our developers, and you can see that we've got access to 3D models. We're also in the process of now getting you access to human dissection. So there's plenty that we're doing. I'm so excited about the stuff that we're rolling out, but you can see that, for us, content and keeping you engaged is very important, giving you a great experience. Okay, so we cover everything. You're not on your own. Our content, you get access to your mentors. It's just try it. For those of you who are here today, I'll get in touch with you, give you guys access to a demo. Just try the content. And all of you will say, wow, Fahim, you weren't just chatting it on the day. No, I'm not. Is that true? Again, there's plenty of students who can give you reviews, plenty that we can do. In terms of what we've covered today, so we're all clear on this. And let me go through some pricing quickly. Our basic courses start at 2,995. Okay. Access to DMP application and so on is £3,000. And access to all the clinical courses combined with the doctor face-to-face at 3,995. That is our basic prices. For those of you who just want to learn to set up a clinic, it is £4,000, and I will teach you everything from start to finish. Application, CQC, the whole thing. It's all there for you, pretty straightforward. But we'll be getting in touch later on to discuss these things. But for one that would probably interest most of you will be, there's my DMP, and then to have access to all the clinical, everything on top, it's 3,995. That gives me everything. What do these courses give me access to? They give me access to DMP, give me access to face-to-face teaching, but not access to the e-learning. If you want this plus access to the e-learning itself, that is here. That is here. That is access to e-learning, DMP, face-to-face, access to our WhatsApp group, monthly live webinars with Doctor. And once you become part of Medline, after the first year, you get access to everything for £30 a month. That's the plan. After the first, you get access to everything for £30 a month. This course is just access to DMP application face-to-face events. This course combines everything where we teach you everything, okay? And this is if you want to obviously just be access to developing your, just say you just want to develop your how to run a business. For those of you who just want to develop your clinical skills, it's 2,995. And you say, look, I don't want to be a prescriber yet. I just want to develop my clinical skills. And you can pay in installments. We accept installments from monthly all the way to, regular. So which university I attend, I've covered that. How do I fill out our KPI? I've covered that. The role of the prescribing pharmacist. So if you're working in a community pharmacy, it's different. In a GP practice, you'll be doing medicine reviews, you'll be seeing patients, you'll be doing clinics, you'll be having access to diagnosing and managing and treating. So there's a lot more that you can do, and it's going to start to get busy in community pharmacy as well. How to find a DMP, we've discussed that. Getting access to a doctor versus a pharmacist, I've discussed that. Can I do it on a part-time basis? Yes or no, you can do your prescribing on a part-time basis, but you need to have access to patients. Again, you need to be practicing, otherwise it becomes tricky. Can I study at home? You can study at home, but the time commitment, I would say even for our courses, we're only asking for 30 minutes a day. That's all I'm asking for. If you can dedicate 30 minutes a day studying, every day, consistently, you will get results. That's all I'm asking for. I'm not saying to you, I understand you're busy. I understand you've got lives. I get that. I'm asking for just 30 minutes a day. With the money back guarantee, that's it. If you can do that over the year, I guarantee that you're going to get results. It's impossible that you want, but you have to be committed. We've gone through cost. It's the future of the profession. How do I choose my scope of practice? I've gone through that in depth as well. Duration of the course, I've discussed that. How do I get my company to sponsor me? Again, if your company can't sponsor you, we can sponsor you if you're struggling with that, no problem. I've discussed a bit about job opportunities. Advanced clinical practice, question mark. I don't feel that that's necessary, to be honest, if you can develop your clinical skills. If it does become mandatory, which I don't think is possible, then you might want to consider that. I've gone through what to expect. Do I need a community pharmacy or GP practice to undertake the course? I've heard some people have failed the course. Yes, some people do fail the course, believe it or not. Some people do fail the course. Just keep that in mind. So Esther has asked, is it £4,000 for the clinic or combined? It's £4,000 just for the clinic. If you wanted everything combined, then it's 6,995. So it's £6,995. That includes your prescribing, clinical skills, face-to-face events, and setting up your clinic. But standalone, it's £4,000. Okay. For those of you who say, look, I've not been qualified for 2 years. Yeah, what should I do? Develop your clinical skills. That's what you need to do. Develop your clinical skills. That's what you need to do. You should be developing your clinical skills. If you've not been qualified for 2 years yet, don't make the mistakes that I made. Develop yourself. How to get on a course? You've got to get in touch with university, and we can help you organize the rest part. How do I find a clinical lead? Again, it should be within your prescribing where you're working, or we can organize that for you. Again, please, please, please. A clinical diploma does not teach you clinical skills. Mistake number 2. No, the clinical diploma is not designed to teach you clinical skills. The clinical diploma is designed to give you access to policies, procedures, not clinical skills at all. Keep that in mind. How do I manage this course part-time with my family? I've asked you, dedicate yourself 30 minutes every day. you will get results. It's like weight loss. Long term. Don't think short term. Think of a long-term strategy. Here we go. Long term. Look somewhere in the corner and think long term. That little speck, not short term. If you think short term, you won't get results. No more acute stuff. Long term. I'm going to make a difference to my life. I'm going to start from today. I know it's not going to happen in one day, but I'm prepared to dedicate myself. You will get results. Okay? Is there funding for community pharmacy? Yes and no. I'm hearing that there are still some places for funding, but the problem is that people still struggle to find a DMP. Keep that in mind. How to strengthen my CV. We don't have time to cover this now. I've discussed about transitioning from pharmacist to clinician. Keep that in mind. What happens after my qualification? Again, that's something that I'll be discussing in future lectures. For those of you who want advice, for those of you, just get in touch, folks. There's my number. Either that way or get in touch. My colleague Aisha or the team can help you. Get advice. Don't make mistakes. That's all I'm saying to you. It's not about the money. I don't care where you go. I'm not interested in who you decide to go with. I don't want you to make the mistakes. Get the right advice. Do it properly. Let's build a profession. Let's make a difference in this world and let's do it together. So from my side, I am exactly 5 minutes late. If any of you have any questions, I'm willing to stay for 2-3 minutes. Otherwise, I need to go in exact 2-3 minutes. Yeah, and I'm done. That is it. That is me. So thank you very much for being here. For those of you who've got questions, please ask me, fire away. I'm happy to do that. And I'm more than happy to go through with you. Thank you, Esther. I thoroughly love what I do. I enjoy making a difference. So it's a pretty, having been done this for so long, it becomes quite natural. And it's going to be, yeah, what's the footy, Chrissy? I hope, I hope that goes well. And God bless you all. Make the difference in your lives. I will be in touch to ask you guys if there's anything we can do for you. Remember the 3 things that we can do: develop clinical skills, find DMP, set up your clinics. You need to make a difference in your life and be the best versions of yourselves and help people. God bless you all. Thank you very much. And I will be in touch, and good luck for everyone in the